Mark, this is Priya. I just want to test your audio. You should be able to use your phone to speak. Can you just try that really quickly so we can test it?
Testing. You hear me okay?
Okay, great. I can hear you okay. If you can just mute your phone when you're not speaking, that would be great. Thank you.
Cindy, I'll look to you for when we're ready to go.
One more minute.
Thank you.
Mr. Mayor, you may start the meeting.
Thank you. I'd like to welcome everybody to the City of St. Helena regular City Council meeting, Tuesday, August 25th, 2020. I'm Mayor Jeff Ellsworth, and I am to read the following paragraph aloud regarding remote meetings. In accordance with Executive Order N-29-20 and guidance from the California Department of Public Health on gatherings, remote public participation is allowed. We will address the order in the following ways. Members of the public may not physically attend meetings. The City Council meeting will be live streamed on Comcast Channel 28 and on the city's website, barring technical difficulties. Those members of the public wishing to participate must do so remotely via Zoom electronic meetings in the following ways. By either logging onto the Zoom link located on the meeting agenda, please download the app to your computer or mobile device and enter the meeting ID, or by calling a listed number and enter the meeting ID. Public comment for City Council meetings will be accepted via email to publiccomment@cityofsthelena.org. All public comments must be emailed by 4 p.m. prior to the meeting. Emailed public comments will not be read out loud, but will be publicly available and attached to the online City Council agenda. Priya Nixon, our assistant to the city manager, can highlight how any other notes on how public participation will be received.
Thank you, Mayor Ellsworth. Good evening, everyone. To participate in tonight's City Council meeting, there are a few different ways that you can do that. If you're joining via the Zoom app, you can use the raise hand feature, which will be acknowledged during the public comment and public forum part of this meeting. If you're using an iPad, it's at the top right-hand corner of the screen. If you're using a computer, it's at the bottom. And it looks like a little hand icon. And then for folks who are just calling in, all you need to do is press *9, and this again is when the mayor calls for public comment. Thank you so much.
Thank you. And now we'll move to our Pledge of Allegiance. If folks would mute their microphones and follow with me, placing your hands on your heart, or your hand on your heart, and follow with me on the pledge. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. We'll move now to our roll call.
Mayor Ellsworth?
Here.
Vice Mayor Doring?
I am here.
Councilmember Koberstein? Chateau?
Here.
Knudsen?
Present.
Thank you. So we're going to be in a little bit different order tonight. We have two presentations we're going to do before the public forum. We have Dr. Relucio from Public Health Department here to give a presentation, as well as a proclamation in recognition of the St. Helena Postal Service. That will happen before public forum. I just want to make a brief comment regarding our current state of emergency situations in Napa County. Though we find ourselves in continuing to find ourselves in challenging situations, we are, as always, strong, proactive, and adaptable. the current situation with COVID-19, nearby fires, as well as the heat and air quality issues persist. And sadly, there has been loss of life and tremendous damage in our region. I would just like to take a moment to reflect upon that and think of those who have been lost, and we'll just take a moment and then we'll move on. So thank you. Thank you. It's with our will, our community spirit, our generosity, and our can-do attitude that we will find our way through this together. So with that, I'm going to now move to item 6.1, and this is a public health update on COVID-19, the COVID-19 emergency by Napa County Deputy Director of Health and Human Services. This is Public Health Officer Dr. Karen Relucio. Dr. Relucio, are you with us here?
Yes, good evening. So I do have a presentation, and thank you. Good evening, Mayor Ellsworth and City Council members. I'm Dr. Karen Relucio. I'm a Public Health Officer and Deputy Director of Health and Human Services Agency, and I'm here to give a COVID-19 update. Next slide. So first, the first thing that I usually start with is our doubling time, and that means that's the number of days that it takes for our cases to double. So now we're now at 35 days, and I'm happy to say that because we are in the thousands, so we're hoping that actually increases with time. We were at 31 days last week. And at this point, if we were to look at 35 days, it would take us just over a month in order for us to get to about 2,700 cases. Next slide. So I want to talk about some good news, actually. If you look at the curve on the left side, you can see how flat it was in the beginning, and then it started to have a more vertical slope. But now we're seeing that it's starting to kind of flatten out a little bit. And if we look at average daily cases by operational period, our peak was in the last week of July, where we were having up to 25 cases a day. And as you can see, this has been decreasing. And at the current time, so we had a good week this week. We were at around 12 cases a day on average. Next slide. So the one thing that is that we're looking at carefully are case rates. So case rates per 100,000 population in the last 14 days. And the reason why we're looking at that carefully is because this is the basis of which we had been placed on the California Department of Public Health monitoring list. So if a county has case rates that are over 100 per 100,000, that puts us on the list. As you can see in the first, in pretty much in the last week of June, we started having case rates that were over 100 per 100,000, and we had stayed on the monitoring list. And we peaked out in the last week of July and in the first week of August at over 200 per 100,000 population. But we're seeing a drop off. So in the last couple of weeks, it has dropped off to 177.6 last week. And then this week, we're at 147.4. And I'll explain to you, we did manage to get off the list just temporarily, but I will explain that a little more because the case rates that are put forward by the state underestimate what we're seeing locally. Next slide. And then looking at our test positivity rate, we had a max test positivity rate in the end of July of 5.4%, but this has dropped. And it hit a low around August 8th at 2.5%, which was, which is still more than it was before we started opening up sectors. We were only at 1.7% in the very, very beginning of June. It went up slightly, but just to put it out there that we're also, we've had less testing volume, mainly because for a while, the tests were taking a long time to come back, so that decreased the amount of people getting tested. But now that testing is coming back in 48 to 72 hours, so that the turnaround time is better. It's hopefully will increase our testing volumes. But of course, we are also responding to a wildfire, which pretty much is distracting from COVID-19. Next slide. And then looking at our hospitalization trends, if you look at the graph to the left where you have the kind of aqua blue line, you can see that the hospitalization curve is beginning to flatten out, and it's starting to flatten out probably in the late July, and has been kind of steadily remaining it's in a better place. And if we look at new hospitalizations by operational period, our max was in the second week of July, but it has been dropping off, and it has remained more stable in the last month. Next slide. And then our ICU admissions, our ICU admissions have been not that high. So, you could see that it looks like there's wide swings, but really, we've had 4 ICU admissions at a time at most, and it has dropped off. We have 0 people hospitalized in the intensive care unit at this time. Next slide. I wanted to talk about our hospitalization demographics. So most of the people that are being hospitalized are those that are 65 years of age or older, or else those aged 50 to 64 years of age, followed by those aged 30 to 49 years of age. And just to frame that, the people that are 30 to 49 years of age, they do have underlying medical problems that puts them at risk for hospitalization. We've had a total of 85 hospitalizations, and I believe at the current time we probably have 6 or 7 hospitalized currently. And when we look at our race ethnicity of those that are hospitalized, nearly 50% are Latinx, followed by non-Hispanic whites, and then followed by other races, including African Americans and Asians. And then 7% are unknown or refuse to give their race ethnicity. Most of those that are being hospitalized are male, with nearly 60% male, 40% female. Next slide. And then our deaths, we've had 13 Napa County residents that have died since March. And March through June had 1 death each. In July, we had 5 deaths, and August had 4 deaths to date. The average age at death was 78 years, with a range of 43 to 97 years of age. And about 40% were Latinx, and then equivalent amount are non-Hispanic whites, and 22% are Asian. Next slide. So the one thing that we've been really keeping an eye on with increased cases is just keeping an eye on what our hospitalizations could look like in the future. So we use models, and just to let you know that models, they're really there as a planning tool just to help us understand where our peak hospitalizations could be. It is not the be all end all of what hospitalizations will look like, but it helps us to modulate, what actions we should take to make sure that we don't overwhelm the hospital system. So I'm going to if you look at the top curve, which is a plum color or purple color, that is if this is a fast-paced reopening. If you see the other line, which is kind of a bluish line, that is moderate-paced reopening. So, and then the lower green line is slow-paced reopening. So the top dashed black line are the total number of hospitalizations that we have had in Napa County to date. And then the dashed gray line, which kind of runs parallel to the green line, are current hospitalizations. So, our cumulative hospitalizations is pretty much behaving, like a county that has undergone a moderate pace reopening. And at first it was actually behaving more like fast reopening, but I think with some of the state orders that have closed certain sectors to indoor activities, that has slowed down some of our cases. The line that's vertical just represents the date of which this data was run. So we are, running somewhere mostly between a moderate pace reopening and slow pace reopening at this time. If we're the thing with modeling is that it's hard to look at peaks way out there because it's really hard to predict. It really depends on what the activities are that are allowed to open and what interventions are taken in order to slow down the hospitalizations. Next slide. And then just looking at our utilization modeling for ICU, the top line is the plumb line represents fast-paced reopening. And then the blue line, which is representing a moderate pace reopening. Our total ICU beds is represented by the red line, which is 32 beds. So if we look at our COVID ICU patients, it's been low. So we've been really behaving like a slow paced opening county when it comes to ICU utilization. Next slide. So we do have a few active outbreaks. Currently we have 9 active outbreaks. We've had a total of 13. We do have 5 skilled nursing facilities that are detecting COVID-19 positive in their staff, mainly because they are required to do surveillance testing. Most of our outbreaks have it predominantly in staff, and they hardly have any in residents. So I just want to let you know the first skilled nursing facility has had detection in staff since early June. However, they've only had 3 residents that came out positive, and it's a very large facility. They've been doing actually really well. So when they test their staff and they turn out positive, what they can do is take them out of work, and it prevents infection of residents, and it mitigates the outbreak right off the bat. They are doing really well. The second skilled nursing facility, which you notice that there's a lot of residents that were infected, and then there were 6 deaths. This is a skilled nursing facility in Napa where it was less controlled. They had a lot of issues with staffing or staff walking off the site, where we had to provide mutual aid in order to have a strike team staff the facility until they could figure out how to staff it with agency staffing. And once they were able to do that and to implement the proper infection control precautions, as well as having a few visits from the state, it actually slowed down the outbreak. So they are in a better place, but they continue to have positive tests. The third skilled nursing facility is also a very large facility, and that they're doing well too. 12 staff, only 2 residents. And, so they're having it mostly in staff. And in our 4th and 5th facility, just have detected it in 1 staff with no residents infected. We also have an assisted living that detected it in 3 staff, but no residents. We did have a couple of inmates test positive, but most of what we're seeing positives are in staff. And in the shelter, we did have 3 residents test positive in the shelter, but it has not spread, and that has been mitigated. Next slide. So this is our resilience roadmap dashboard, and just looking at our regional stability, as you can see, Napa and Lake have gone down in the case rate per 100,000. Our vulnerable population stability is pretty good, so we haven't had any more cases in the last 14 days of residents within these skilled nursing facilities. Most of the skilled nursing facilities have enough personal protective equipment. If we look at the percentage positivity rate of tests, we have gone up compared to last week. We were at 2.5%, but 3.6% is still pretty good. So a warning rate for the state is 8%, so we are far from that. Our case doubling time has increased, and the percentage of cases aged 65 years of age or older is decreased to 10.2% since last week. And then our outbreaks, it's still equal to what it was last week. So we have 9 active outbreaks. Our hospital capacity, so just to let you know, the disclaimer of this data is that St. Helena Hospital is closed because it's evacuated. So the data here is really just reflective of the Queen. This is what the current situation is. And technically, this probably should be saying that we have half the capacity as usual until we get to the point that St. Helena Hospital is repopulated again. And then Queen of the Valley has enough personal protective equipment. And if we look at our disease severity, our hospitalizations have been equivalent this week as last week. And our deaths, we've had no deaths this week. In the previous week, we've had 2 deaths. And this is all related to the skilled nursing facility, of which there has been one of our worst outbreaks. So our death rate is 1.0%, 6.3% cases being hospitalized, and 1.8% of cases in the intensive care unit. Next slide. And then this is the California Department of Public Health Monitoring Program data indicators. So we were taken off the list on Thursday, and then our narrative was taken off on Friday. So we were off the list. I think that although we are off the list, the state's data is actually less than what we're seeing locally. So we've had to meet with them to just kind of figure out where the differences are. We're technically off the list, but as of Monday, when we met with them, we were already exceeding 100 per 100,000 population. So it's a possibility that this is not going to be a long-lived phenomenon. And in order to make a difference in some areas, we have to be on the list. We have to be off the list for 14 days straight. Next slide. So what does being off the monitoring list mean? So we have to be off the list for 14 consecutive days to allow schools to reopen for in-person learning. So schools may open for in-person learning if we're off that list for 14 consecutive days. However, the very thing that got us on the list also led to some modifications of businesses, which were restricted to outdoor only. This included some sectors that had just opened, including gyms and fitness centers, personal care services, hair salons and barbershops, indoor malls, and non-essential office spaces. That is still restricted to outdoor only. And the only way that we can get that back is if the state health officer rescinds the order. Next slide. So I also want to talk about what's still restricted by the state order. So I already described in the right side here what monitor counties had to close because of being on the list. In the left side are statewide closures. So this is not just monitoring counties, but it's every county across the state of California where the closure of bars, breweries, and pubs, indoor and outdoor, were expected to close. And then also it restricts activities outdoor only, including wineries and tasting rooms, restaurants, movies and family entertainment centers, zoos and museums, and card rooms. I think there is a perception that I'm in control of this as the local health officer, but we are under state health officer orders at this time. And the implications of not following a state health, the state order is that there is, realignment backfill as well as CARES funding, which is federal funding that is tied to the state, and then the state then allocates it to counties and cities. And if we are out of, if we're not in compliance with the state order, then we potentially will not get that funding. Next slide. So I want to give some testing updates because as we're all aware, testing has been, the turnaround time for tests to come back has been terrible. It had, initially in April, we were having test results coming back in 3 days. And then by the time we got to the end of July, we got to mid-July into, part of August, it was taking up to 19 days to get a test back, which is really useless. The reason I say this is because the isolation period after somebody gets COVID-19 is 10 days. So we don't have any way of doing disease containment if we don't know what the results are. So I'm happy to say that the Quest results, so Quest is what our mass testing site uses, and it's run by Verily, which does the project baseline. So if you sign up for the mass testing sites at the Expo or St. Helena or Calistoga or American Canyon, they use Quest. And now we're finding that these results are coming back in 3 to 5 days. The Napa County Public Health started contracting with Fulgent Genetics. We had a backup account with LabCorp, and then once their turnaround time started to get longer and longer, we needed another option. So we are now going to be using Fulgent Genetics that will provide backup for public health lab testing. Also, our public health lab tests, so the Napa County has a shared public health lab with Solano County, Yolo, and Marin. And so it's a 4-county lab. And at one point, our capacity was restricted to 125 specimens daily. And we were in the midst of many outbreaks where you end up using a lot more tests to test people in the facility that you have to basically test the entire facility every week. So that eats up a lot of tests. That has increased to 150 specimens daily, and that's actually a good thing because having less outbreaks and more public health lab testing increases our flexibility as well. And then we've had hospitals using other backup labs. So St. Helena is also using as a backup lab Origin Labs, which is based out of Boston. And then the Queen of the Valley is using Northwest Labs, which is based out of Oregon. So this is increasing the capacity for lab testing where you're going to have tests that come back faster. And then just in terms of the future of the mass testing site, the state is putting out an RFP for mass testing vendor for test sites across the state. Some of their goals is to make it more flexible than just having a drive-through site. And I think some of the spirit of this is to increase equity of testing, so you can make it more flexible for people that don't have cars or for populations that are less likely to sign up in a web-based testing platform due to technological difficulties, or else it could actually invoke fear in our undocumented populations. Next slide. So since we are in the midst of a double disaster, I thought I would talk about COVID-19 and wildfire response because having a wildfire response in the midst of COVID-19 brings up certain challenges where we have to take different precautions. So I think it's important to note that wildfire smoke increases susceptibility to COVID-19 infection because of the effect it has in the lungs, and vice versa. So people with COVID-19 infection will be more sensitive to the effects of wildfire smoke. And the best protection is to stay inside with recirculated air and not opening the windows. That's the best situation. If you're in a situation where you don't have there's just not enough ventilation, there are ways to make a clean room where you can have a HEPA filter or a fan within a single room that's an internal room. If you have forced air systems, using HEPA filters or MERV 13 filters, and then resetting the air on recirculate or on rather than auto. And then there are special considerations if you're evacuating to a shelter. So first of all, before I talk about that, I want to say how fortunate we've been in Napa County to be able to do sheltering in hotels. So that avoids the whole congregation issue in the first place. But as a backup, the Crosswalk Church was opened. And it was opened, instead of taking 120 people, it can only take 60 because they have to account for social distancing. So for people that are evacuating to shelter, it's really important to follow the CDC recommendations, including wearing face coverings, keeping your distance, and washing your hands. And just to note that the masks, the face coverings that we use in order to slow the spread of COVID-19, they offer very little protection against wildfire smoke. And this is what becomes challenging in our messaging because N95s are the best for wildfire smoke, but we also know that they are in short supply as frontline healthcare workers use them during pandemics. If we have a facility with an outbreak, they really burn through a lot of N95 respirators. Next slide. So as I stated before, our evacuees were placed in hotels instead of shelters. And for those that have lost their homes, they're going to be in longer term hotels or situations to keep them sheltered. And some of the shelter adaptations include increasing physical distancing between cots, doing symptom screening for people that come into the shelter, having a more robust disinfection procedures and hand sanitizer, and then avoiding any buffet style food. So it has to be individual box meals in order to prevent the spread of COVID-19. You know, I think the other thing that this brings is that fire camps, you know, you have basically, you know, like over 1,000 firefighters in a large, you know, in the Calistoga Fairgrounds where they've set up base camp. And there has been some pre-planning on that, mainly because there's a lot of people in that camp and they had to do additional adaptations in order to prevent spread. And, you know, they're definitely in a situation that's vulnerable and more vulnerable to exposure. And so these are just some considerations that we were meeting about before the fire broke out, that we would continue to have to practice going forward. Next slide. So also the thing that is really tricky with smoke exposure and COVID-19 is that some of the symptoms are very similar. So as you can see, the words that are underlined under smoke exposure and COVID-19 are pretty much very similar symptoms. But the only thing that's going to be different is, next slide, is that COVID-19, you start to have these symptoms, which are, you know, fevers and chills, body aches, and the loss of taste or smell. That's a really, you know, it's a very distinctive symptom of COVID-19. And then as well as having gastrointestinal symptoms such as nausea, vomiting, or diarrhea. Next slide. Okay, that's the end of my report.
Dr. Relucio, I want to thank you very much. I'm going to open it for some council questions, but before I do, I just want to say thank you and let folks know the work that the County Department of Health has been doing has just been remarkable in getting assets and resources where they're needed and having an overview of this whole situation despite the challenges at the state and federal level. So thank you for being here and presenting this to us. Are there council questions at this point? I'm seeing Ms. Chateau.
I do. First, I just want to say, Dr. Relucio, I agree with all of what our mayor just said. Thank you so much for being here tonight and everything that you do. I learned so much from this presentation, and I know how hard you and your staff are working for all of us. So I'm incredibly grateful for what we get here in Napa County and what you do. I had just a quick question about, is there going to be more site mobile testings available where they can actually go out to sites that might need them for people that can't take time off of work, or if there are spots where there's a lot of people that really need access to the testing?
Yeah, you know, we are working with partners mainly because a lot of my staff are really pretty much relegated to case investigation and contact tracing. So we've been working closely with St. Helena Hospital Foundation that has been doing some testing. And then also just trying to work with other partners that are doing mobile for the industry. We're hoping with the new RFP that the state is putting forward that it will increase the flexibility for mobile testing, especially for hard to reach populations that are not likely to go to a mass testing site. So we're hopeful for that. And it's just you know, staffing of it at a long term, you know, is what is probably the most challenging part. The other thing is that we're finding that there is a way to teach people how to self-swab so that it doesn't have to be a healthcare provider taking the swab. People can be taught to do that. And there are saliva options for testing that are becoming more available where that doesn't require any type of, poking or prodding. And that'll be easier where you can have more like home testing, for example. So I know that the state is looking at more of these opportunities, but we're also pretty much whispering in the state's ear on ways we can make this a lot more flexible going forward and not having it be as staff intensive.
That would be great because I'm seeing more and more people buy those themselves if you can afford them. You know, they can get $100 plus a test. So that was my question in terms of an equity issue, if that was going to be more available for people moving forward or not.
I'm hoping that the state picks the right vendor that gets us to that place, because I know that testing equity has been a big issue.
Okay. And then just really quick, I can't help but ask about the schools. So I understand for the schools to reopen that we have to be off the list for 14 days. And then even after that, then the schools, are you having conversation with the different schools? So schools cannot open in St. Helena until we're off the list for 14 days. And then it's between you and the schools to figure that out? Is that?
So, yeah, so this is for, I think there's two separate issues. So there is, if we're off the list for 14 days consecutively, all schools can open if, with physical distancing, adaptations and all that other stuff. I think the area where I have to have the individual conversations in the application is for the waiver. So elementary schools, TK through 6, can open if they apply for a waiver. And what that entails is having a reopening plan. And then there's several components of this waiver that was written by the state that they have to fulfill, including having a point of contact for contact tracing, having a letter of support from their teachers, just because there is, the tension between, parents who want to have their kids in school, and then, the people that are teaching that, there's, I guess, there are mixed reviews and how they want to go back to in-person learning. So waiver gives that ability. A couple of weeks ago, I couldn't accept waivers because we were over 200 per 100,000 population. But since we are now kind of in that, downward slope, I'm now accepting waivers for reopening. So
Okay.
that's the application process
All right. Thank you very much. Thank you for allowing me to ask 2 questions.
Thank you. Are there additional council questions at this point? I'm seeing Mr. Knudsen.
Dr. Relucio, thank you so much for joining us. I really appreciate it. And I was happy to make the request for you to join us and to educate our citizenry and residents of town. My question is, can you lay out a scenario if, say, a member of a household was to come down with COVID, or at least the symptoms, what the process is for their testing and receiving a response? And then what would the other family members or those that were in the same living space, and also say the person had been to Model Bakery or been around town, been to Safeway, how would you go about trying to notify folks that the person had come into contact with? Thank you.
Yeah. So if someone becomes symptomatic, and let's say they get tested, and then their test result comes back, we receive test results through CalReady, which is a statewide system. So labs are supposed to, by law, electronically transmit the results to the state database, and then we find out about the case. Or else somebody might call us and say, I tested positive, here's my test result, and that will initiate a case. Our case investigator then interviews the person that has come down with COVID. And then those that are close contacts that live in the same household are issued issued a quarantine directive, and the person that's the case is issued an isolation directive. At that moment, the case investigator reviews. They review what kind of contacts people have had. So the ones that are really count are those that are close contacts. So people that have been within 6 feet for over 15 minutes without a face covering. So if there's a casual trip to a grocery store and you went out by checker, but you were there for only 5 minutes, that's not considered a high-risk contact. However, if somebody said, "Oh, I had a conversation with somebody for over an hour in a closed space," then that becomes a contact. People that are closer contacts are contacted by our contact tracing team. And they are notified just to watch for symptoms and where they could get testing if they develop symptoms. And we usually advise that if they develop symptoms, they should get tested. But if they're just exposed, we advise that they wait 5 to 7 days for testing, because it increases the sensitivity of testing if they end up having, early exposure and disease.
And a quick follow-up, thank you. for most of the folks that have proven to have COVID, is it easy to understand how they caught it, or is it sort of a mystery?
It's variable. So, you know, a lot of our transmissions, like, you know, usually if we have a large family and a lot of them test positive, then, you know, a lot of them it could be assumed to be household transmission. You know, we see there are some people that just don't know how they've gotten it. And, you know, we see that. And then others went, you know, participated in like a family gathering. They might have gone to a, you know, baby shower, or else they went out of state and stayed with other family. And then they came back with COVID. So it's really a mixed bag of what we're seeing. But I think community transmission is probably number one. So that it's really variable. And, you know, there are people that just don't know how they got it.
And sorry, do you mind if I ask a further question, Mr. Mayor?
Sure.
Oh, go ahead, please.
Yeah. So finally, I know that there, at least the rumor is that there was a death in St. Helena, and yet, you know, you're not allowed to share information or whatnot. Can you tell us what the protocols for sharing information so that the residents don't, you know, are sort of not in a state of not understanding what's going on?
Yes. So I think there's a delay in the ability to share information about deaths because we have to confirm that the person died from COVID-19. So there's a process of making sure that it's certified by the medical provider that took care of that patient. We've had situations where people were dying of something else and they happen to get tested for COVID-19 because they were in a facility and then they tested positive, but their primary cause of death was not COVID-19. Their primary cause of death might have been cancer. And it just so happened they were co-infected with COVID-19. So ascertaining the cause of death sometimes takes longer. And part of, you know, we have to do that rigor in order to record that data correctly.
Okay, so but there's not a presumption of privacy for people who unfortunately have died of COVID that we're not allowed to talk about them? I think that's
I mean, we have to protect people's privacy. When we don't disclose names of cases, we don't disclose names of contact, and we don't disclose who died. You know, and it's really going to be up to the family to disclose whether somebody died of COVID-19 in the public, but it's not something that we disclose.
And do we encourage them to be, you know, straightforward with that, or is that there's no policy on that?
No, we don't. You know, we don't push them to do that. That's really up to the family's discretion.
Okay, thank you.
Thank you. Are there additional council questions? Seeing none, I'll thank you again, Dr. Relucio. Just to give the community a little more clarity, the municipalities in Napa County all rely on Napa County Health for this coverage, and so it's a comprehensive approach, and we're really grateful for your focus and attention through all this, and just want to say thank you for being here and keeping a watch on this as we go forward and helping educate us tonight. Thank you.
Thank you.
Okay, now we will move on. We'll move on to item 6.2. This is a bright spot in our challenging times. This is a proclamation in recognition of the St. Helena Postal Service's important contributions to our community. And we're blessed to have Francisco Ortiz here, who is a treasured member of our community and has been a long-time member of the Postal Service, who's retiring. This is an item that was brought forth by Councilperson Koberstein, and I'm wondering if Mary, if you could give us a brief introduction of how this came about before we read the proclamation.
Sure. You know, I think several weeks ago there was an outpouring of sentiment when people began to learn that Francisco had retired and left the post office, and St. Helena residents gathered together to collect many gifts and express our appreciation. And I was talking with Councilmember Doring about it, and I know I see my mail carrier, Elizabeth, she's running faster than ever, if that's possible. And we just felt it would be a good time to step up and not only recognize Francisco on his retirement, but also everybody at the post office for everything they're doing during this COVID pandemic. It's been, I'm sure they will tell you, an incredibly busy time for them. And normally at this time of year, we recognize someone when we have our community potluck. And it seemed appropriate in this time and the circumstances we're in. So I'm glad we're doing it.
Thank you very much. So we're going to do this proclamation. Each of us on the council are going to read a portion of the proclamation. I will begin, and then Vice Mayor Doring will take over, and we'll move through the council. So welcome to the post office and to Francisco being here. And we will begin with this City of St. Helena proclamation in recognition of the St. Helena Postal Service's important contributions to our community and designating this Labor Day, September 7th, 2020, as St. Helena Postal Service Day in St. Helena.
Whereas Article 1, Section 8, Clause 7 of the United States Constitution, known as the Postal Clause or the Postal Power, gave Congress the power to establish post offices and post roads. And the Postal Service has been an essential piece of America's history even before it was America. Whereas since its founding in 1775, the Postal Service has successfully and consistently bound the country together, providing the same service at the same rates to communities across the country. Founding Father Benjamin Franklin was the first Postmaster General under the Continental Congress, and a young Abraham Lincoln was appointed Postmaster of New Salem, Illinois in 1833. Whereas Alexis de Tocqueville, the French writer, thinker, and traveler who famously came to America in 1831 and chronicled what at the time truly was an exceptional nation, understood the vital nature of the U.S. Post Office, calling it, quote, a great link between minds, end quote, in a spread out frontier nation. Whereas today the Postal Service is one of the country's largest employers of veterans, with 97,000 on the payroll. Postal Service jobs help elevate tens of thousands of African American families into the middle class during the Civil Rights era. The Postal Service workforce remains one of the most diverse in America.
Whereas St. Helena's first post office was established on December 15, 1856, and received mail once a week, originally housed in the Star Building that later moved into the Brook Building. Rural delivery service began in January 1905, and village delivery service started in July 1927. Whereas in 1940, a new and our current St. Helena Post Office building was commissioned as part of the Works Project Administration Project. Built on the site of the former Carver Mansion, it was formally dedicated on March 2nd, 1941, as Native Sons Grand Officers sealed the plaque to the front of the building at a ceremony attended by hundreds, including postmasters from all over Northern California. Whereas the following statement from Congressman Buck was read at the 1941 dedication: the Post Office Department is the greatest public institution of the United States government. Its publicly owned buildings speak to all who enter them as temples of democracy. They are not placed haphazardly, but where conditions justify their erection. Those who enter there solely for business purposes might well pause, as they do when they enter a place of worship, and realize that these buildings are the actual symbols of our national republic's life. Whereas we are all familiar with that informal postal service motto long associated with the American postal worker: neither snow, nor rain, nor heat, nor gloom of night stays these couriers from the swift completion of their appointed rounds. In this year of 2020 in the midst of the COVID-19 pandemic. To snow, rain, heat, and gloom of night, we now add the words, nor pandemic.
Whereas during this COVID-19 pandemic, we choose to honor all of our St. Helena Postal Service employees for their tireless performance of the demands of their jobs, made ever more difficult and urgent during the pandemic. And whereas on any given day, Lisa Hicks, St. Helena Postmaster, and Kevin Gamble, Supervisor of Customer Service, arrive at work at 4 a.m. They spend their days tracking down undelivered packages or mail sent to the wrong address, handling customer inquiries, helping at the window to serve customers in the lobby, preparing reports and certifications, sometimes covering carrier routes, and making sure that at the end of each day, all the carriers have completed their assignments and everything is locked and secure. And whereas at 4 a.m., 6 days a week, 800 to 1,100 parcels arrive by truck at the St. Helena Post Office and are processed for delivery. During the COVID-19 pandemic, the St. Helena Post Office is processing and delivering 9,000 to 11,000 parcels per week, far more than the 6,600 to 8,000 parcels delivered during the height of the typical holiday season. Another truck rolls in from Oakland at 5 a.m. with the majority of mail to be delivered that day, and another truck 2 hours later. Our St. Helena Postal Service also receives, stages, and transports mail to the Angwin and Pope Valley post offices.
Oh, Mary, your microphone?
So used to being muted. Whereas the longtime carriers and clerks at the St. Helena Post Office have worked an average of 22 years in the Postal Service. The carriers begin to arrive for work at 6:30 to 7:30 a.m. to prepare mail and packages for delivery. On occasion, they are out as late as 7:30 p.m. We choose to honor all our carriers who are moving faster than ever, including city carriers Daryl Jeffcoat, Chris Haberman, Dillian Brever, Liz Dostal, Gordon Adams, and Shannon Lavaca. Our rural carriers, Miguel Macias, Kirsten Majario, Kathy Hepoff, John Bernard, Ashley Boydston, Jenny McDonald, and our highway carrier, Jason Raphael. And the clerks are responsible for sorting the incoming mail and the collected and outgoing mail in order to load it on the final truck that leaves the post office around 6 p.m., 6 days a week. We choose to honor our clerks who are busily preparing return parcels and mail and cheerfully helping customers at the service window, including clerks John Gerhardt, Renee Andaya, Ed DeLeon, and Ken Logan, Doug Yeager in Pope Valley, and Carla Silly Morris in Angwin. And whereas we honor St. Helena Postal Service Clerk Francisco Ortiz, who recently retired from the St. Helena Postal Service after nearly 2 decades of service. Named Employee of the Year in 2016 by the St. Helena Chamber of Commerce, Cisco virtually made your day when you went to the St. Helena Post Office. He is beloved by the community for his kindness, his warm smile, and the twinkle in his eye, not to mention his daily walks around town, and he's dearly missed. And whereas the employees of the St. Helena Postal Service work together as a family, cross-trained to help each other in order to get the job done every day, they all work very hard every day. They love and appreciate when customers provide treats or goodies, like cold water on a hot day, cakes or breads, or even a kind word that can make their day.
And whereas 91% of Americans of all political persuasions view the U.S. Postal Service favorably, the highest ratings of any federal agency, according to a recent nonpartisan survey, and we in St. Helena love our Postal Service and all its employees too. The crew at St. Helena just make it look easy because of their years of experience. And whereas Postmaster Lisa Hicks says, thank you to the residents and businesses of St. Helena for all that you do for us. We have a very busy little office, and we say thank you too. Now, therefore, be it resolved that the St. Helena City Council recognizes and honors the St. Helena Postal Service, our Postmaster Lisa Hicks, Customer Service Supervisor Kevin Gamble, all the clerks and carriers, and recently retired clerk Francisco Ortiz for their many contributions to our community. Be it further resolved that Jeff Ellsworth, Mayor of the City of St. Helena, and the entire City Council hereby issue this proclamation on behalf of the city, proclaiming Labor Day, September 7th, 2020, as St. Helena Postal Service Day in St. Helena, and ask all who live and work in our community to join us in expressing our deep gratitude to Francisco Ortiz on the occasion of his retirement, to our Postmaster Lisa Hicks, Customer Service Supervisor Kevin Gamble, and to all the carriers and clerks of the St. Helena Postal Service for all that they do to strengthen our community through their service to all of our residents and businesses. August 25th, 2020. Thank you very much with deep gratitude. We have a signed proclamation that will get to you. We can't do it remotely here, but we will get it to you. And just want to thank you for being here with us and sharing this time with us. Do you have a few words to say at this point? Mary, did you want to?
No, I thought maybe Lisa would have some.
Yes, Ms. Hicks, do you have
The proclamation's in the mail.
Francisco, do you have a few words to share with us?
Yes, I would like to say that I did enjoy my 15 years of service in St. Helena, and it was a privilege to help each one of you. And I miss you guys. Thank you.
Thank you. You brought such a wonderful spirit to our community, and we're so thankful for that. So thank you for being here tonight as well.
Thank you. And you give a hug to Phoebe.
Okay. Thank you. Well, with that, then I'll thank our postal employee service folks for being here tonight, and then we'll move on now to our. Let's see. So it looks like our clerk says you have the proclamation, Lisa. Great. Thank you. Thank you for being here. Okay, now we will move on to our public forum. And this is where members of the public are entitled to speak on matters of municipal concern, not on the agenda during public forum. Each person's comments shall be limited to 4 minutes, and each person is entitled to speak on any non-agendized item only once at any meeting. Brief questions by council members for clarifications may be posed and answered, and council members may make requests that items be placed on future agendas. But in accordance with state law, no substantive discussion or action may take place unless and until the matter properly appears on the agenda. I'll open the public forum now. And Priya, are we seeing some hands in the queue?
Yes, we are seeing some hands, so I'm going to unmute this first person. Hold on one moment. You should be able to speak. Last name Howard.
Yes. My name is Bryce Howard. I'm the general manager for Upper Valley Disposal Services and Cloverflat Landfill. And I thought I'd just give you a very brief overview of our fire control plan and sort of safety things that we've done out there recently. In 2018, the county fire marshal and the environmental health department required us to put together, working with them, a fire control and prevention plan. In 2019, the county fire marshal accepted that plan and put it into effect. That plan's really broken up into 2 basic areas. One is the actual water supply that we work closely with the county fire to come up with what those requirements should be, and included that in our plan. It includes things like how much total volume of water we should have on site, what type of flow that the county fire would like to have, what type of pressure, and over what duration of time. That facility, that system is in place. It also required us to put hydrants in at certain key locations that were close to areas that they deemed to be appropriate. So that was the first part. The second part of the plan was more operational in nature. So the operational piece of that plan for Cloverflat Landfill included employee training, covering the trash or the waste every day with soil, supplying a couple days worth of soil in key locations for fire prevention, requiring us to have a certain amount of equipment on site, required us to take temperature readings of green waste piles if we had any on site, and requires us to do a 24-hour fire watch during fire season. So like currently right now, we have 2 employees that will be out there all night and every night in the entire time. The other piece of that was notification of emergency services. We're required at any time that any fire of any size happens at our facility to contact emergency services immediately. That was all part of sort of the second phase of our plan. Along with that, I'd like to point out that we have monthly inspections by County Environmental Health that make sure that we're conforming to that plan as well. So they come out every month and do an inspection of our facility. The last thing I'd like to mention is a couple of things that we've done additionally to that plan. We have put in a fire camera. Actually, it's a camera that was put in by a third party that is doing a sort of a proof of project. So we have a fire camera up on our facility that monitors our facility as well for any smoke or anything that comes up, and it operates 24 hours a day, 7 days a week, 365 days a year. We also have additional water supply besides the water that is required that's dedicated for fire control. We also have a vast amount of additional water in case that was needed as well that we use just for our daily operations. We also put in a circular road around our facility recently in the last year that's been graveled and has been made all weather so that no matter what time of year, if somebody needed to get around our facility, they could. And the last thing that I think we'd like to point out is a couple years ago, some residents up in our area came to us and said, we would really like your help in providing a secondary access to our houses and our different facilities we have up in our area. And to do that, they needed to come through our land. So now we maintain that secondary access, which is a dirt road basically, that is for about maybe 24 residents up there. We maintain that for them in case there's an emergency where they need a second access to get out. That's all I wanted to say. Thank you very much for your time. I appreciate it. Thank you.
Thank you. And I saw also a request from Ms. Pastoni in terms of looking to agendize a discussion on this. I think that looking at our comprehensive fire strategies in the county, I think that that's a welcome discussion. So thank you for being here today and talking with us. With that, I will ask Priya if there's additional public comment.
We do have additional public comment. I'm going to unmute this individual, last name Lincoln. Please unmute yourself and you should be able to speak.
Thank you, council members, for this opportunity to speak. I am a member of the Black Lives Matter Monday Vigil community, and I'm here to talk about racial equality and justice in St. Helena. I recognize this is a turbulent time and our community is especially hurting at the moment. But because of the urgency of our concerns, we ask to be agendized as soon as possible. The weekly Black Lives Matter Monday Vigil began as a local expression of national movement demanding that impacts of systemic racism, police brutality, and racial equity on Black, Indigenous, and other people of color be addressed in all areas of society, including civic, private, business, education, employment, and housing. We ask the city to make a commitment to become an anti-racist and update the St. Helena vision and mission statement to reflect this commitment by the adoption of relevant resolutions. We further recommend that the staff develop and council adopts an action plan with defined goals, milestones, and a plan or scheduled reporting on progress towards this commitment. In our discussions, we've identified 4 key areas that the plan should address. Number 1, representation and inclusion. Create pathways for civic engagement that make it clear that people of color are welcome to participate and lead in local government. Establish a standard that all city government communications, websites, forms, and documents be provided in both Spanish and English. Acknowledge the Indigenous history and cultures and lands upon which St. Helena sits. Provide community listening sessions with outside facilitators in English and in Spanish. Number 2, housing and amenities. Recognize that housing inequities in St. Helena and the resulting segregation of communities. Address availability and location of affordable family and worker housing and the availability and location of developed parks. Number 3, education. Ensure that city government and staff members are aware of issues of systemic racism, know how to look for, find, and correct these issues. To provide cultural awareness, sensitivity, communication, education, and to provide anti-racism and implicit bias training for all city employees. Number 4, policing public safety. Reimagine how public safety and well-being are organized and funded. Increase the frequency of implicit bias training from every 5 years to every 2 years, and add training in cultural awareness, sensitivity, communication on that same schedule. And comply with Policy 392 as outlined. Community Relations Coordinator, annual surveys, and a community advisory board that prioritizes all residents and reflects the demographics of the city. This is a consequential time in our country and our community. We look forward to continuing this critical dialogue as an agenda item in an upcoming meeting. Time is of the essence, and we hope you share the same sense of urgency as we do. Thank you.
Thank you for your comments. I've discussed with the city manager and brought up with the vice mayor to locate a date for an upcoming town hall meeting where we can focus on inventorying the concerns and look at how best to agendize and move forward with these issues and this discussion. So thank you very much for the comments tonight. And now we'll move and see if there is additional public comment.
There is additional public comment. I'm going to unmute this person, last name McKinnon. When I unmute you, please state your full name. You should be able to speak now.
Thank you. My name is William McKinnon. I'm appearing on behalf of Water out of California, and considering how full your evening is, you'll be glad to hear I do not intend to make a presentation. In fact, I'm here only for 2 reasons. The first one, we've sent in a comment letter. If there are any questions, I'd like to be able to answer them. The second one is to offer a real simple solution to the problem, which is the city has consulting groundwater geologists, you have hydrologists, you have the appropriate consultants that can investigate this matter. And we suggest that you consider just doing that. We will be happy without charge to do peer review on whatever modeling they want to do, although quite honestly, it's rather routine. And if we did not believe this was a serious problem, we wouldn't have brought it to you. And we aren't bringing this to you in an aggressive manner, but rather to say, here's a problem, let's examine it, let's determine the facts, and contemplate the solutions to it, because there are solutions to it. Simply doing things the way you are is not the only way to do things. And I will offer as an example the fact that routinely water diverted into storage and reservoirs is limited by month. That is to say, you can divert from October through to April, but you don't divert in the summer months. That is a routine constraint on operation. We just received the city's production of well records today, this afternoon. We have not had a chance to look at them, but hypothetically, we can think of 4 to 6 different ways the problem could be solved. So if there's any questions, I'm here. Otherwise, I have nothing else to say, except ideally what you can do is have your engineer consult with the appropriate people. You can get an answer. It's not going to be a very expensive inquiry. This is not something where there's studies or field surveys or anything needs to be done. In fact, I believe we've assembled all of the data that needs to be examined, and we'll be happy to turn it over to your consultant and let them use it so they don't have to assemble it themselves. So if there's any questions, I'm here. Otherwise, I thank you very much for your time.
Thank you for the comments. And seeing no questions, I will ask our assistant to the city manager if there is any additional public comment.
I'm not seeing any, but I did see a hand earlier that went away, and I just want to make sure. Okay, good. That hand reappeared. Last name Pastoni. I'm going to unmute you. Please state your full name. You should be unmuted now. I'm going to try again to unmute you. You should be able to accept the unmute.
Hi, can you hear me now?
Yes.
I was hoping to have followed Bryce on his presentation, but just to let you know, I am the Chief Operating Officer for Cloverflat Landfill, and I have worked in our family business for 31 of its 55 years. I'm also a resident of St. Helena, and our family's been here 134 years. We have made a commitment to partner with this community, and I have worked doing that my entire life. I'm here because Mayor Ellsworth made a comment at the last city council meeting attacking our business. Mayor Ellsworth insinuated that Cloverflat needs to close and is a danger to the community because it's a potential fire risk. The landfill, as Bryce mentioned, has had challenges, but it's currently operating in a compliance mode, and there hasn't been a fire there in 2 years. One of the most interesting and alarming and disappointing issues for me is that Mayor Ellsworth, who I've known most of my life, who also worked for our company post high school and has had multiple conversations with my family members over the last couple of years, sits as the alternate on the JPA, which is the body that governs our Cloverflat contract and the hauling contract. He knows that the site is compliant. He attends all the public JPA meetings, and he's toured the facility. In fact, I organized the tour for him last October. He didn't have any issues last October and actually was very pleased about our progress. We are a community partner. He is an alternate on the JPA board. This is a new platform for the mayor, in my opinion, and a conflict of interest. I was recently here before you in May to talk about Clover and the community's need for commercial composting, new climate change regulations, how that facility is becoming a partner. As a matter of fact, today we received our air permit and joint technical document to begin composting commercial food waste at Cloverflat Resource Recovery Park. When I was before you in May, there was no mention at that time of any concern of shutting down or moving the landfill. So why now? It's a politically motivated comment, and we should be offered ample time for Q&A from the mayor and the council and the community constituents. Mayor Ellsworth is not a fire chief or a fire expert. Our facility is compliant with the county fire and CAL FIRE requirements. Mayor Ellsworth said it's in the wrong place and should close. If we were to close, it would not be his decision, nor the decision of the city of St. Helena. The site has operated since 1963, and once a landfill closes, generally a transfer station and recycling operations are assumed, always community serving problems and programs and infrastructure. On occasion, closed landfills become other creative enterprises. The landfill produces methane gas. We currently partner with PG&E and create electricity from this gas, providing electricity to 1,000 homes in the city of Calistoga. The landfill will continue to produce gas and have to be monitored for 30 years post-closure. Today, we are preparing once again to take in fire debris, recycle metal, rock, concrete, and perishables from evacuated areas of the fire. We are your partner. We would very much like the opportunity to return and continue to talk about the benefits and the sustainability programs for the future at this facility, and to assure the community they should not fear it, as Mayor Ellsworth suggests. Thank you for the opportunity to present.
Thank you for the comments. We'll look forward to this continuing conversation. We can see with the local situation with the current fires that it's very pertinent to have this conversation. So we'll look forward to further discussion on this. So thank you. Ms. Nixon, are we seeing any additional comment at this point?
I'm looking right now and I am not seeing any additional public comment.
Thank you. Okay, with that, I will then close the public comment and we'll move to reports by staff and City Council, future agenda items, and AB 1234 reports. And we'll call upon our City Attorney first to see if we have any reports.
Good evening, Mayor and Council. I don't have a report tonight.
Thank you. And move to our City Manager.
Hello and good evening. I will provide a fire update on item 10.1 a little later in the agenda. That's all.
Very good. Thank you. Our Finance Director.
I have nothing to report tonight. Thank you.
Thank you. Our City Clerk.
Nothing to report.
Thank you. Our Public Works Department.
I think the updates will be later this evening, so thank you. Nothing to report.
And from our Planning and Building Department.
Hello, good evening. Just an update. Farmstead, the public hearing will be rescheduled for September 14th at 6 o'clock. Thank you.
Thank you. And from our Police and Fire, do we have a representative this evening? And Mark, you'll be doing the fire update in a bit. Okay, the City Manager will. So we'll go to our council members. Councilmember Knudsen.
Given the general challenges, our Parks and Rec meeting was canceled last week, but I also want to say that there's been some public comment about the lighting situation at the skate park. And guess what? We're on it. And thank you for the comment. And we are on it. You know, the lights have been on during the day. They're not on at night. So thank you, community, for making sure that we're aware of it. And we are. Thanks.
And Councilperson Koberstein.
Yeah, I have one announcement. I think this actually comes up somewhere in the written materials later for this evening's agenda. But a couple weeks ago, the Upper Valley Waste Management Agency awarded the City of St. Helena a $120,000 grant, the purpose of which is to begin phase 1 of the Activate Money Way portion of the streetscape plan. And I would like to suggest, I know we are crowding things onto agendas, but that we have a future agenda meeting to discuss this and some other UVDS issues, including the bill that is coming down very soon, where we will have to comply with organic waste disposal reduction. I would also suggest that we include some of our business owners who have property that adjoins Money Way. I have received some comments about what Activate Money Way means and what might happen. And this is really just stage 1, which is addressing the refuse collection along that particular street. So if another council member would agree, I'd say when we can work this into our schedule, we agendize the grant and follow up on UVDS issues for council discussion.
I agree.
That's fine. 3.
And Vice Mayor Doring.
Nothing in particular to report. I'm a little concerned about a letter that was written to the Planning Commission with respect to Farmstead, a letter from a law firm. I was surprised that we would agendize that Planning Commission hearing so early, September 14th. I had asked offline to have a response to that letter. And so City Manager Presswich, is that in the works? I think it would behoove the city to have an opinion on that opinion.
We've had conversations about that, and I can provide a briefing and update for the City Council.
Thank you.
Thank you.
So thank you. And I'll just make a few more comments here regarding the current situation. Wanting to make sure that we thank everybody for their focus during this very challenging, as Dr. Relucio said, double emergency. We need to remember that that even though the red flag warning has been taken away and there's been the intensity of the fire issues may have subsided a bit, fire risk is always very high. So we need to be sure that we're always ready if we need to leave. So having those go bags ready and a plan as we move into fire season is very important. I want to remind folks always the 3 W's related to COVID: wash your hands, wear a face mask, and watch your distance. These are going to be important things. Let's keep that in mind. And always, as a community, neighbor to neighbor, communicating, talking, and helping each other as we go forward. So those, I just want to make sure we remember that with all the other business and things we do. We have 2 emergencies happening now, and we want to stay, focused, alert, and calm as we move through it, communicating as a community. So with that, I will then. Oh, I'm sorry, Anna, Ms. Chateau, did I miss you? I apologize.
That's all right. We have a lot, so I'll just be really quick. I have nothing to report other than I am very glad that our climate change meeting is on through the county, our countywide climate change meeting. Since that is another emergency that we can add to the list, I'm glad that we're continuing to work on it. And if anybody's interested, you can find the agenda and the Zoom link through the county website.
Thank you, and I apologize again. Okay, with that, we will move now to our consent items. This is our consent calendar where members of the, this is our staff briefing, item 7.1. This is the update on wastewater treatment plant upgrade by Erica Smithies, our Public Works Director and City Engineer.
Thank you, Mayor Ellsworth and council members. I have an update. We had a check-in call today with the state water boards regarding the status of our cease and desist order, as well as our timeline for completion of the phase 1 upgrades. Very good conversation, candid conversation about updating. They provided us a schedule via a letter allowing our milestones to push out to 2023. They have stated today that they want to give us a more official document, an updated cease and desist order, reflect the letter they provided us in January of 2018. So we're working on an updated construction schedule, environmental compliance for CEQA design and construction schedule we're working on the next couple of weeks and providing them so they can get to work on that. Meanwhile, environmental baseline reporting continues. A couple of staff members will be visiting a package plant in operation in Madera on Monday, and will be reporting back to me after their visit to see how it went and how that's working for that special district or wastewater district or municipality. And hopefully I can provide some feedback at the next meeting. Thank you.
Thank you. Are there any questions at this point from the council? Mr. Doring, Vice Mayor?
Just for the benefit of the community, you've used this term often, and I think it's good to kind of clarify what it is you mean. What is a package treatment plant?
Thank you. It is actually a plant that is manufactured at a facility. The one we're looking at is actually in Arroyo Grande, California, Central Coast. And it's manufactured on site, brought into the city on skids. And then equipment's hooked up to our trunk main. Actually, they'll be utilizing, I don't want to get too in details, but it's literally a packaged plant that comes to our site, and then we connect our facilities, our existing facilities to it. So it's straightforward online in a short manner, and as soon as 12 to 18 months from fabrication to delivery to installation at our city. Does that help?
Thank you.
You're welcome.
Thank you. Additional questions from council? Seeing none, we'll now move to our consent calendar. And this is where members of the council or the public may ask that any items be considered individually for purposes of considering alternative action, for extended discussion, or for public comment. Unless that is done, one motion may be used to adopt all recommended actions. So we'll start with item 8.1. And I'll be looking also to see if any hands are up from the community as well as the council. We'll begin with item 8.1, 8.2, 8.3, 8.4, and 8.5. Seeing nobody pulling an item, I'll ask for a motion to pass the consent calendar.
I'll move that we approve the consent calendar.
I second.
And a roll call, please.
Councilmember Koperstein?
Yes.
Chateau?
Yes.
Knudsen?
Yes.
Vice Mayor Doring?
Yes.
Mayor Ellsworth?
Yes. Thank you. We'll move now past, seeing nothing in the public hearings. We'll move now to item 10.1. This is City Manager update on fire emergency and COVID-19 emergency. This is Mr. Presswich, our City Manager.
Thank you, Mayor. Well, it's been a wild ride for the last 8 days. It sure seems longer than that for me. But I think today, this afternoon, we received some positive news for St. Helena, for Angwin, and our particular region. So tonight I'm going to speak about just a general fire update, the ways the city is communicating, and finally some comments on disaster assistance for those affected. So with respect to the fire update, as you've probably read, this area is competing with the San Jose area for either the second or third largest fire in California history. So that's for scale. It's just an incredible sized event, and it didn't really get started until lightning strikes on last week ago, Sunday evening into Monday, and we saw some smoke for the first time to the hills in the east. CAL FIRE issued a mandatory evacuation for portions of St. Helena to the east of Silverado Trail. That was issued last Tuesday evening at approximately 6 p.m. This afternoon, after several days of fighting the fires and a lot of private efforts, the evacuation order was transitioned to an evacuation warning. So that's very good news. It does not include Angwin and some other roads in the area, so those are still under a mandatory evacuation order. But the order for the city limits and those areas, just essentially immediately east of Silverado Trail, not all the way into the hills, but just east, is now in transition to a warning. And we've issued a press release this afternoon that clarifies what roads are open and which are not. This series of fires, which we initially knew as the Hennessey fire and other references to Etna Springs and Pope Valley, is called the LNU Lightning Complex. The President of the United States has issued a federal disaster declaration, which means that the federal government picks up 75% of the disaster costs. The Governor of California has issued a disaster declaration, which means in this case, because of the federal order, the state will pick up 75% of the remaining 25%. Representative Thompson indicated earlier this week that he would be introducing legislation into Congress that would increase the federal share from 75% to 90%. And generally, when situations like that happen, it often results in the state picking up the full remainder of the disaster costs. So at the moment, the city's expenses are probably going to be any of the eligible expenses associated with addressing these challenges will be our responsibility from 0% to 6.25%. In terms of communications, the city is sharing information about the fire on multiple platforms. So we have issued approximately 16 press releases to date. Generally, those have been falling about twice daily around the midday or early afternoon. Today's was a little earlier, and then typically a little bit into early evening after we've received some additional briefing information from firefighters and Fire Incident Command. The plan will be to continue to do that, but also to add press releases more frequently if conditions change. And a good example of that was what happened following the Nixle late this afternoon or early this afternoon. You saw the city issue a press release a little earlier than prior days. We're also communicating via e-news. This is information that anyone can sign up for on our website, cityofsthelena.org. We've also built a web page that provides a lot of information about the fire and related matters. We are communicating on social media. That's primarily Facebook and Instagram, and I know others are posting information on Nextdoor as well. We've developed a fire information board at 1480 Main Street. That's the police department, and that's updated every time we issue a new press release or we have a new map for the fire. And I know that that's been very helpful for a lot of people. I've seen a number of people looking at that board regularly. And then finally, I don't want to overlook how important NIXL is. The county and CAL FIRE have been primarily influencing the decision on when those NIXLs related to the fire are issued. It's a very important community resource. To join NIXL, and we have, I know a lot of people joined 3 years ago, and we have more now. Text your zip code, that's 94574, to 888777. And to receive messages in Spanish, text ESP to 888777, and you will be prompted for a zip code. We've also added some digital message boards around town. Those were essentially transitioned from a COVID messaging to a fire messaging, and then to an evacuation messaging. So as things become, as the outlook looks better in the coming days, I anticipate we will begin to adjust that messaging on the digital boards as well. In terms of disaster assistance, anyone that's impacted by this disaster can register for federal financial assistance through disasterassistance.gov. When federal disaster and state disaster declarations are issued, there's generally an individual assistance component and a public assistance component. So the city and the schools and others will be looking to the public assistance side of this. But on the individual assistance side, anyone that suffered losses from the fire should first talk to their insurance companies, but also register at that website, disasterassistance.gov. And there's also a telephone number that you're welcome to call as well. That number is 800-621-3362. That's 800-621-3362. And we're providing information on our website and through our press releases as well. I'll stop there, and I'm happy to answer any questions that the council or community has.
Thank you, Mr. Presswich. I'm going to open it up for questions in just a moment. I want to thank our city staff for the incredible work they've been doing. I would just want to remark on that. Through these emergencies, our city staff have stepped up for this community, and certainly our first responders, our public safety team, but our city staff has kept things moving in a very solid, stable way. So I just want to say thank you. And with that, I'm going to open it up for questions from the council or initial discussion here if I see any hands. Okay, not seeing any hands.
I would just like to thank the city manager for what I think is a vastly improved stream of communication from the city manager's office, especially to city council members. A lot of good information is coming out on a regular basis that helps me to kind of get a better understanding of what is going on, and then that helps our constituents so that I can explain that to them. So I do appreciate that, Mark. Thank you so much.
You know, and if I could just comment on that, I mean, one of the advantages this time is that we already had an emergency operations center operating virtually, but it really goes a lot farther beyond that, Vice Mayor Doring, and we have some incredible staff that have been working through the weekends, through the evenings, and I really appreciate all the work they've done in helping us stay organized. And on top of all of the communications efforts by the city, our firefighters and the volunteers in the Pope Valley and the Etna Springs and beyond areas when CAL FIRE was stretched incredibly thin, they have a story to tell. And I know that all of us really appreciate and thank them for the hard work they've been committed to for the past week and more. And there'll be a time when I think it'll be appropriate to honor them. They're still battling the flames, but they're making good progress. And I just want to acknowledge all of their efforts as well.
Thank you. Mr. Knudsen.
Yeah, I also want to add, thank you, Vice Mayor Doring, for your comments. I also want to say that sort of as a, all of us have become sort of digitally conversant, right? But the analog signs in front of the police station, in front of the fire station, very, very helpful. And CAL FIRE was really behind on this one, and we were very blind, I thought. And so having that resource for the community, them knowing that they could head down to City Hall, Old City Hall, to see what's going on was super helpful. So I want to thank you for keeping that, and the staff and city employees for keeping that up to date. Thank you.
Thank you. Any additional council discussion comments, Ms. Chouteau?
I just wanted to say thank you to everything that people have already said. I ditto all of that. And also just a reminder and thank you for people who have been able to reach out to the neighbors and help them. Not everybody can, not everybody has the capacity. There's so much that's difficult right now on so many different levels. But if you do have that capacity, I had a good reminder when I was checking at the fire board, and there was an older gentleman who had evacuated, and he had Nixle on his phone, but he didn't know what to do with it. So he didn't know how to click on the link or how to get the information. And it just was a good reminder that not everybody can access the press releases and the Nixle alerts like we think they can, and with a little bit of help they can. So I just put that request out there for anybody that does have the capacity to reach out and help their neighbors in these hard moments.
Thank you. Additional council comment or discussion? Seeing none, I'm going to open it to public comment. Ms. Nixon, public comment.
I'm looking right now to see if there's any public comment for this item, and I'm not seeing any raised hands.
Okay, very good. I'll bring it back. I want to also put out there that if folks, these are challenging times. If folks are in a situation where they need help or know somebody who is, I want to reiterate, please reach out. We have a lot of community assets. We have the Up Valley Family Center. We have Rianda House, the Boys and Girls Club, the St. Helena Hospital Foundation, and also the Napa Valley Community Foundation. So folks can reach out seeking help. Also, those who have the ability to donate to these organizations, those donations keep funds flowing in the community during these difficult times. So if you have the means to help that way, please do. But also, if somebody is struggling or you know somebody who is, please reach out to these organizations or the city or a neighbor, because we want everybody to get through this together. And with that, I will also thank our city manager, Mark Presswich, for just his astounding focus and ability to see the big picture as we move through this. So it's really, really appreciated. Are there other council comments at this point? Okay. If there's anything else to add on this item at the moment, we will move on from this and move into our next item, which is item 10.2. And this is a review of City of St. Helena Small Business Sustainability Loan Program, discussion and direction regarding possible modifications to expand eligibility and consideration of a resolution updating the Small Business Sustainability Loan Program to include organizations providing critical services. And this is prepared by April Mitz, our finance director.
Thank you very much. So on June 9th, the City Council did adopt a Small Business Sustainability Loan Program, or an SBS program, which did provide for small businesses who suffered losses as a result of COVID-19 shelter-at-home orders. And the City Council designated up to $300,000 for this particular program. To date, the city has actually expended $140,000 in loans, and it is leaving an available balance of $160,000. At the last City Council meeting on August 11th, the City Council did express an interest in reviewing the current SBS program, and discussion at this meeting did include conversations considering the expanding of the loan program to address emerging COVID-19 challenges, which also included the availability of child care centers and other critical services and needs. So as a response to the Council's request, the City staff has prepared a modified resolution as well as a modified loan program for council consideration that if it were adopted, it would remove the stipulation of the business having to be a for-profit organization, because currently as it's modeled, it does state it has to be for-profit. It would also expand section 3.1 to include having a facility within the city limits, where previously it just stipulated it had to be a storefront or an office and did not actually include the terminology facility. And then also the third item that we are looking at adding is adding to the eligible business type list organization, adding to the current business list type organizations which offer services to those who live or work locally. So the conceptual modifications are shown in track changes in the attachment that's on the staff report. And then the review period, I did receive some comment regarding the review period. Currently the review period, as it's stipulated in the current program, it's every Thursday we review. And so what was anticipated is with these modifications or any other modifications council directs, what we would do is the applications would be starting to be accepted immediately. And then the first review would take place on September 3rd, which would be the following Thursday. And that would be considered technically the 13th round if you go in succession order that we had in the original policy. And all the other provisions of the program would remain the same unless City Council directed otherwise. So based on that, I would like to receive some council dialogue feedback and any other ideas for expanding this program.
Thank you. Is there initial discussion from council? Ms. Koberstein.
Yeah, thank you for this, April. My only comment is in your track changes under the program requirements, 3.1 eligibility. I think it would be helpful to people who might be interested in applying to be a little more specific there. We just talk about a local service provider who provides services. Maybe we could be more specific about what we are talking about, whether we're talking about childcare, food service delivery, just to make it clear which types of nonprofits or other businesses might be eligible.
Thank you. Further council comments, questions, discussion here? I concur in terms of the specificity of what we're bringing up. I certainly know that the child care issue is coming forward strongly countywide, and there's a way to look at this as supporting a business that also supports other businesses. There's a sort of a compound benefit in looking at helping in this regard, and it's really being recognized countywide. So perhaps making sure that that's clarified in there, and if there are some other aspects too, to be specific. I'm waiting to hear back from Preschool for All, who has a dialogue with the preschools in town to get a sense of the need locally in our town, and hopefully have some of that information soon and can get that forward as well. So if there are no other council comments at this point, I will open this for public comment. If Ms. Nixon is seeing any public comment.
I'm looking right now to see if there's public comment for this item, and I am not seeing any.
Okay, so I'll bring it back to the council. Any thoughts at this point? Ms. Chouteau.
I think it's a great thing to do. I like the 3 additions that we're talking about making the changes to the resolution for.
Okay. So with that, Ms. Mitz, do you have what you need to make the changes?
I have I heard two more specific items. So first was childcare. The other was food service or food service delivery. And then was there I did not hear a third, but I could have missed the third.
Mary, was there a third?
I didn't mention a third. I just think we should make clear that we're talking about businesses that are helping residents and other businesses, during the COVID pandemic. The two I mentioned were childcare and food banks, food delivery services, programs.
Okay. Mr. Knudsen, did you have a comment?
Don't we need to vote?
Yes. Well, I just wanted to make sure that we had the items.
Sorry, I thought you were asking for direction, so I was hoping we'd make a vote.
Yes, we will. I just wanted to make sure that we had the language. So with that, is there a motion on this action?
I move approval for the recommended action.
And is there a second?
I'll second that with the understanding that the language in 3.1 is going to be modified.
And a roll call, please.
Councilmember Chateau?
Yes.
Koperstein?
Yes.
Knudsen?
Yes.
Vice Mayor Doring?
Yes.
Mayor Ellsworth?
Yes. Thank you. Now we'll move on to item 11.1. This is receive and file the Q4 FY fiscal year 2019-20 financial report, unaudited, and this is also prepared by Ms. Mitz, our finance director.
Great, thank you. And I'll make sure I can share my screen. Okay, can everybody see my screen right now?
Yes.
Okay. So as the report states, this is the fiscal year 1920 Q4 budget review unaudited. And I do want to make a notation that I have added some updates to the PowerPoint presentation that were not included in the staff report because the timing of our cash flows right now, we did receive our June 2020 sales tax information. So I have added that to this report. My next slide. Okay, so the general overview is it does reflect transactions posted into our Springbrook system through August 12th, 2020. We also did include the sales tax with the updated June 2020 actuals, and the report that was posted for City Council and for the public did not have those June numbers. They only had the estimates. The transactions for fiscal year 20 will continue to be posted. Typically, we get done posting transactions as well as journal entries September 1st to mid-September-ish, and then from that point, we work with the auditors to finalize the audit. Details for sales tax Q4 will not be available until September. This is something that I know several people have asked me about. They want to know what were the trends. Is it online sales? Is it more retail sales? Is it building materials? That's information that we do receive from Avenue Analytics. And typically what we will do is we get that about 2 to 3 months later. So we're expecting early to mid-September to get that information. So that way we can provide more analytics to see primarily during the months of April, May, and June, exactly where the sales tax dollars were coming from for the city. So our general fund revenues year-to-date physically received is a little over $13 million. This does not include the May and June sales tax because while we know what the dollar amount is, we do not receive the actual deposit devices for a little bit later, but we can at least book it as a receivable. The total revenues of the adjusted budget, which was presented to City Council in February, we're at 90%, so we're doing better than we anticipated with COVID-19. So here gives a quick timeline of the COVID-19 estimates versus the revised estimates. So on 4/14, when we presented to City Council our initial estimates for COVID-19, we are anticipating about a little over $13 million. On 8/11, which is when we posted the city council report, it was $13.9 million is what we were estimating, and that includes those sales tax dollars we haven't received yet. And on 8/25, the latest update that I have as of today is $14,139,000. So as you can see, it is higher by about almost $1.1 million from the initial estimates that we presented in April, and is primarily driven by sales tax. So $746,000 of that $1.1 million is sales tax driven. The other amounts that are driven from that are part strike team reimbursements, higher than expected building permit applications. We had an STR settlement earlier in the year, so those all add up to the $1.1 million. So this gives you a projection. I wanted to really highlight sales tax projections that we have. So in the first column, you'll see the sales tax by month. So under our adopted budget, this is what we estimated to take in each month. So in March, under a normal circumstance, pre-COVID, it would have been $286, almost $287,000, $264 for April, $308,000 for May, and then $285 for June. When we revised our estimates due to COVID-19 back in April, March was revised downward to $179, April $66, May $76, and then June $71,000. And then our estimated updates at the time that we published the agenda was $148 for March, which are actual numbers, $159 for March, which was actual. May was $291,000, which was actual. And then we had the estimates for June of $106,000. So that was slightly upgraded from what we had at the April 14th meeting of $71,000. And then what we actually received was $251,000. So this definitely exceeded the expectations that we had, as well as some of the county predictions, the Visit Napa Valley predictions, as well as the predictions from Avenue Analytics. So I know we've stated it before, but we know COVID is a very fluid environment, and trying to actually forecast was very, very difficult. So we just want to make sure that you're presented with the most up-to-date information we have. For Measure D, you can see we did the same thing. So we have our March, April, May, and June. So this is the half-cent sales tax measure. And so you can see for March, we're at $72,000. For April, we're at $90,000. May, it was $156, and then June, our estimates were $73,000, and we just about doubled it for June. So that's $147,000 is what we're actually going to be receiving for June. So as far as the general fund revenue summary goes, property tax didn't change that much, and I tried to use the same formatting so you can see what the adopted is, the adjusted as of February, the revised COVID numbers, and then what was published in the agenda versus what we have now. So you'll see your property tax is at $5.4 million. The largest gain between these two was the shifting ERAF that we received. Sales tax, that's one of the largest ones that we had a difference is the COVID revised numbers was almost $7 million. We estimated it was going to be 4.3 when the report was published, and we are actually receiving $4.5 million. TOT, our COVID revision was $2.28 million. Our estimated update, which is the same as today, is $2.4 million, so it's about $200,000 higher. That is primarily due to a couple hotels that were actually remained open during COVID to service critical people, where they had truckers that were coming through, or we had at least one person who was receiving treatment at St. Helena Hospital that stayed at one of our local hotels. And then the other boost that we had for TOT did have to do with us opening up mid-June as opposed to July 1, which was the initial estimates. Other revenue has not changed much from the COVID update of $1.76 million. We're actually coming in at $1.7 million. So what this means is our updated estimates for the end of fiscal year 20 unaudited is $14.13 million as opposed to the $13.062 million here. So again, it's about $1.1 million higher than what we anticipated. So overview of our expenditures for the general fund. So for the transactions posted through 8/12, it's $13.9 million, which were 89% of our estimated expenditures. We are estimating an additional approximately $990,000 to be posted to process. And then this also includes the first payroll that was paid out in July, which actually needs to be journal entry back into the previous fiscal year. So that's part of that accounting for the $990,000. Our estimated expenditure, we are expecting $14.4 million for last fiscal year. And that also includes any of the immediate budget reductions that we did as a result of COVID. And that also does include COVID-related expenditures that we had to outlay as soon as COVID hit, everything from the personal protective equipment to purchase to the new shield guards that we have in our facilities to the N95 masks, or at least the face guard masks. So we have several expenditures. We have attorneys' expenditures that are in there that are COVID-19 related. All of those expenses we are going to be seeking reimbursement for. However, it's not a guarantee, but those expenses are included in that $14.4 million. So if we want to look at an overview of expenditures for the general fund by department, so you'll see the blue line is the adopted, the orange line is the adjusted, so that includes any adjustments we had throughout the year, either due to council resolution or if it or we had an adjustment due to any purchase orders that rolled over from the previous year. And then you can see here where the year-to-date spent is. So we're tracking pretty well in this category. We're definitely not going to go over what we anticipated. You'll notice right here in fire department, we have a negative 7%, and that has to do with strike teams. So that is strike teams as well as additional staffing that we had to do in the fire department as a result of COVID-19. So our general fund net position estimated, so you'll see our estimated revenues as of 6/30/2020 is $14.1 million. Our estimated expenses are $14.4, plus we're looking at about $500,000 in purchase order rollovers. So those are funds that were committed during the current fiscal year, but they weren't expended yet, so we roll them over so we can still have the funding available for next year. We do have a use of reserves of $786,000. So we're looking at an estimated unassigned net position of $7.13 million, which is 48%. And just as a reminder, we're starting out the current fiscal year with this 48%, but knowing in fiscal year 2021, we've designated $1.7 million in reserves to be used, as well as we've also, the sewer lateral program, while that is going to be recorded and it's going to be debt that we'll be receiving back, that could be up to $200,000. Plus, we are taking on a lot of expenditures right now due to strike teams and due to the fire emergencies that are happening. Again, we will be going for every type of state and federal reimbursement possible, but those expenses are going to start hitting this net position until we receive any of our reimbursements. So before I move on to the other funds, I would like to pause and see if anybody has any questions.
Are there any questions from council at this point? Mr. Knudsen.
Is it okay if I make a couple comments, or do you want to have me save those for the end? Because I don't actually have questions, I have comments.
April, what works for you in terms of how you're presenting?
Either one is fine with me. So it's what the council desire is. It seems almost appropriate to take it by fund, but I am up for your feedback.
Let's do that. Let's do the general fund first, and then move on. So, David, if you have comments now.
Yeah. So this is really, really interesting. And so basically, the general fund has over $7 million in it right now, which is much better than we were expecting when COVID first hit us. And we were planning on using $2 to $3 million of our general fund this year to fill in a revenue gap. You can't put on the brakes fast enough, but we put on the brakes very quickly. And now we're actually using under $1 million for the general fund for our 2020 fiscal year conclude June 30th. That's a really surprising and welcome result for the city. The other thing is I want to commend and appreciate the city employees and their union who are willing to help us. When you don't know what's going on, you need to clamp down on your expenses. And it was very handy and helpful for us to have the help that the city employees provided to the city so that we could fit within whatever was coming next. And so thank you very much. The only thing, Ms. Mitz, that I want to sort of point out for the future is that we had a collapse of our TOT of about $1 million compared to what we were expecting. but all of that only happened in about 4 months. And so if we were at that level for the next year, that will continue to be a big hole for us. So sales tax is doing remarkably well, and I think many of it's those packages coming through the post office. Of course, our fees, there's building permits going on in town, and our sales tax is performing extremely well. So I think we have a lot to be grateful for, despite this crazy environment that we're all in. And I want to just caution council about the fact that TOT will, I believe, continue to lag over this coming year. Thank you.
Thank you. Any other council comments here on the general fund? Okay, seeing none, I will hold the public comment at the end of the till the end of the presentation, but we'll open for public comment at that point. Ms. Mitz, do you want to continue with the other funds?
Yeah, thank you very much, and thank you for your comments, David. So for the water fund, our overall revenues is $6.576 million. So right now we are at 100% of the collected. It is important to note, and I have a final slide at the end of the presentation to show you, when we say it's 100% collected, that is basically what we've billed, because it is an obligation for whoever has used the water or wastewater services to pay the city for that. And so when we do say collected, that is 100% through the end of June 30th. So we are 100% on the water fund, which I was pleasantly surprised to see. Our expenses are at $5.7 million at 86%, and we are on target. Again, we are expecting some more invoices to be paid through the end of beginning of September, mid-September. So that will shift this number and this percentage a little bit, but we are looking on track for our expenses. For the water fund expenses by department, so you'll see here we have our adopted, adjusted, and year-to-date spent. So the bottom line is showing what your available is as of August 12th. For the attorney's budget, we have mentioned this several times, the negative amount that we're over on this is due to litigation, but that overall we should not exceed our water fund expenditures. I believe the forecasts were right there. It might be within $5,000, but we're really close on the water fund. For the overview on the water fund, so our revenues, we have our adopted, our adjusted, and our projected. So overall, we're expecting to receive $19,000 more than what we anticipated initially at the beginning of the year. And I do have to give big credit to our finance manager, Mandy Kellogg, because this was the closest that we have ever had our projections this year, and she got them right on track. And then the expenses, again, our adjusted budget is $6.7 million. 23,000. We're expecting 6.7 million, 28,000. So a variance of over being $5,800, which I don't believe that we'll actually go over that, but that's just taking all of our outstanding invoices into consideration. For the net position of the water fund, the beginning fund balance as of 6/30/2019 is $3.6 million, and this is for our operating fund only. This does not include our CIP funds. Estimated revenues is $6.5 million. Estimated expenses, $6.6 million. We're including about $111,000 in purchase order rollovers, and that leaves us ending fund balance of $3.5 million with a 52% net position. And then I will roll right into, if the council's okay with it, right into the water fund or wastewater fund, because it's closely tied, and then I have the one grid at the end that I'd like to show you. So the wastewater fund, overall, our revenues collected is $3.274 million, which is 98% collected. Our expenses are $2.994 million. We're 86%, and we are on track for our expenses as well. For the expenses for the wastewater fund by department, so you'll see again for the non-departmental, we're at 8% of budget available. City council is 14, admin 12, finance 12, attorney 58. So we did have savings this year, and as well as public works, we have 15% available. The overview for the wastewater fund, so our revenues, we're projecting we're $82,000 less than what we initially projected. But luckily, even with the projected budget, our expenses from the rollovers last year were still in line with what our adjusted budget was. And so we're showing that we're going to be under budget by $36,000 in our expenses. For the wastewater fund net position, we started out with $2.7 million. Our estimated revenues is $3.2 million. Expenses is almost $3.5 million, plus our rollovers, gives us an estimated net fund ending balance of $2.5 million, which is 70%. And again, just a reminder that this dollar amount here does include the $1.15 million from the settlement agreement and is only the operating fund and not including the CIP funds. So this is the one chart that I did want to bring to your attention when we talk about what has actually been collected for water and wastewater. So total this is our aging analysis that we have for our water and wastewater funds. So here's the number of accounts that are at anything past 30 days past due. So you can see in fiscal year 19, at this same time frame last year, we had 179 accounts that were past due. We had 54,000 that was 60 to 90 days, or 30 to 60 days late, almost 12,000, 60 to 90, 7,100, 90 to 120, and then we had $60,000 of over 120 days. We knew that there was going to be some impact on this aging report, first due to the shift into the bi-monthly billing. That was a normal expectation. But then now with one of the only things that the city really had in its power to be able to collect on accounts that were past due is to shut off the water. With COVID-19, there is a moratorium on any shutoffs for any delinquencies. So we have seen a rise in the amount of delinquent accounts. It is comforting to see that most of those delinquencies are within 30 to 60 days, and they're not necessarily the over 120 days. But I wanted to at least point that out to City Council, and this is for both water and wastewater combined. So knowing when we say that we've collected the funds, when we're reporting it as revenue, it does not take into consideration the amount that actually has not paid and is over 60 to 30 days late. So with that, before I move on to the next section, I will pause to see if anybody has questions on the water and wastewater side.
Any questions on this section from council? Okay, seeing none. Thank you. This is an excellent breakdown, by the way. And we have another section here.
Yes, there's just one quick follow-up section. It's on the CARES and the leak adjustments. So for the CARES, so this is a low-income subsidy program for the water and wastewater. Probably a good reminder to any resident out there, we still are taking applications for this. So if anybody is struggling, they can definitely come to the city and we can help them out with this. We currently have 99 participants. The subsidy that the city did provide from May 1st to June 30th is $15,000. The annual total is just about $49,000 that the city has provided to these residents. We did have one additional participant since the start of COVID-19, so that's something we are tracking as well to see how many more participants we are getting as a result. And then to date, we had, my apologies, that 11,000 shouldn't be in there. That was a typo. So that's the end. We just have one additional participant. For the leak adjustments for Q4, we had 7 leak adjustments, and these were for any leaks that happened up until the last billing cycle in June. As the residents as well as council is aware, City Council has passed the ordinance that we are in a stage 1 emergency water shortage. And so as soon as that is declared, we actually do not do any more leak adjustments. So this is everything up through the end of June. So we have 7 leak adjustments for a total of 157 units of water. The subsidy from May 1st to June 30th was $1,000, and then the annual total, can't see over my screen, was $6,000 for the CARES and the leak subsidy. The council action on this is receive and file this unaudited report, and I'd be happy to answer any questions.
Thank you. Very much appreciated. I'm going to bring it back to council and then open the public comment. Am I seeing any comments or questions from council? I am seeing none. I am going to ask Ms. Nixon if there's any public comment at this point on this item.
I'm looking right now to see if there's any public comment, and I'm not seeing any.
Okay, thank you. I'll bring it back to council. Any last thoughts on this? I'm seeing none, and so this is a receive and file, and so we will do that, and thank you very much for this presentation. With that, we're coming to the end of our agenda. I want to, Mr. Doring, am I seeing a? No, okay, thank you. So is there anything else for the good of the order from the council or staff? So with that, I'm going to once again thank our community for being stable and strong through these challenging times. I want to remind everybody the 3 W's. Wash your hands, wear a face mask, watch your distance. I want to remind everybody to stay calm and alert and have the go bags ready and a plan if we do have to leave. And again, thank our staff and our council for all the continued focus and work. So we will see you at the next meeting. So thank you very much, everybody.